I'm going to move on to the second question. And I went off, I apologize, I went sideways a little bit. And we've already started to touch on this, which is how can traditional Chinese medicine help those with long COVID, ME/CFS, and related condition? Because they're like a complex, right? They're very similar in a lot of ways. And which therapies do you find that you like to use, or which strategies do you like to use for these invisible illness and complex post-viral type cases? So is there any specific thing that you like to do, a specific treatment, or is your approach a mixed approach and you find that an integrated approach is the best? So if you don't mind, how the official question is, how can TCM help those with long COVID, ME/CFS, and related illnesses? And are there specific therapies or strategies that you utilize in your practice for common symptoms these patients experience, such as pain, post-exertional malaise, moderate to severe fatigue, POTS, which is positional orthostatic tachycardia syndrome, dysautonomia, sleep disturbances? You don't have to answer it for all of them because that's a big, big question. But maybe if you want to answer for one or two, that would be wonderful. And Amy, since you were cut off, if you don't mind, you go first.
Sure. Thank you for the opportunity. So what I would say is, as one of my patients said when she came in after she hadn't been in it for a year, you're going to tell me to soak my feet in hot water. And it's going to be a different reason than the last time you told me to soak my feet in hot water. Why? Because soaking the feet in hot water to the top of a crew sock with a cup of Epsom salts, what does that do? Well, it roots the heat under the cooking pot, which is going to help with symptoms of POTS. It's going to help with fatigue. It's going to help with anyone who has latent virus or even fevers. Why? Because it roots the heat down. A pathological entity like heat flaring cannot perform a physiological function like good digestion and good bowel movements and not having headaches, right? So doing that for 20 minutes a day. And as you do that, especially if you're in pain, use box breathing. In through your nose to the count of 4, hold to the count of 4, and out through your mouth to the count of 4. You can look on the Cochrane Review for information about how that works with your vagus nerve to help with pain. If someone has insomnia, they will likely be instructed, and this is a safe thing for any of you to start doing tonight, to breathe into the count of 4, hold to the count of 7, and out to the count of 8. This is integrative medicine demonstrated to stimulate the vagus nerve, which calms the nerve system. Another thing anyone can do is, you got a hair dryer, even if you don't use it on your head, use it on your low back and the bottoms of your feet. The low back is the Mingmen fire that will nourish you. It will warm your kidneys. It will help you function better. The bottoms of your feet are kidney 1. If you live in the Commonwealth of Massachusetts or any state that is not warm, please wear wool socks. Why? Cotton is useless when wet. When we're coming into the fall, you go into a place that's heated, your feet sweat. You come out and your feet are cold. And now kidney 1 is cold, and all of the precious points on the inside of your ankles are cold. And if you wear wool, they will still be warm. And these are things that any person can do. And the last of my big things that anyone with these things will be likely asked to do is to buy a water bottle that they love, a metal one or a glass one, at least 20 ounces if you can carry that, and add electrolytes to it as long as that's appropriate for your condition. With POTS, it helps a lot of people stay upright. It helps with dizziness, can help with nausea, can help with migraines. But these are the simple home remedies that I have people do that you can do that will support you, that are often part of any of the above named biomedical diseases that manifest with or without COVID, long COVID. They will nonetheless be putting support and nourishment in your energy bank.
Thank you so much for that very simple kitchen table medicine. So Chinese medicine can be very simple in kitchen table style, where you could do it at home, and it can also be extremely complex, targeted herbal therapy that's based for your specific conditions. And going back to that slide, the superior doctor is going to look at all of the factors and create the treatment plan. Oh my, I did not do that on, but create the treatment plan that works best for you and adjust it. So, Misha, would you like to, Dr. Cohen, would you like to answer this question on common therapies or strategies you utilize?
Sure, and I think Dr. Major just encapsulated a lot of what I would be doing with people now. I would tend to rather. I love the idea of the hair dryer, by the way, but I teach people how to do mops and have them do it at home. And I do have people do a lot of partnered work and teach people how to do foot massage and moxa on kidney 1. Many people can use the moxa on the bottom of the foot on kidney 1, also on the back on the Mingmen that Dr. Major was talking about. And also, so I often tend to start with acupuncture, moxibustion, and then dietary therapies, and help people trying to understand, because a lot of people come and say, oh, I eat really well. I said, so what does that mean? And so a lot of times people are eating cold and raw foods and having digestive issues that are associated with some of those issues. And for people who have chronic illness, a lot of times it's really important that people primarily be eating cooked and cooked foods that have warming quality. A lot of times people are, not just for people who are cold, even if people have what we call toxic heat, there's underlying conditions of deficiency and coldness that is often taken care of by working with people with eating in a different way. It's like traditionally Chinese culture uses kanji, juk during chronic illness. And what we would do is sometimes that's not so great for somebody who has a high A1C or something like that, so you may do alterations of that using other kinds of grains or a smaller amount of grains and more soups, but using soups and all of that that you can make at home, or you can have friends make for you if you are too fatigued. I have people go home and either have partners or themselves or other people, or even themselves just making soups. You can even get soup, that bone broth that is pre-made, and add vegetables to it and just let it simmer. And so it takes you 5 minutes to cook something as opposed to 1,000 hours, And also we might add herbs to it. And so a lot of what I like to do is not just give people herbal medicine to take as pills or powders or teas, but to give people herbs that they can add into foods that are going to be supportive. And so, ginger is often something that's very, very helpful for people, but it depends on how it's given and what the digestive process, because ginger is different the way that it is processed in Chinese medicine. So it's helpful to have a practitioner who can actually help you do that. I did see one thing I know Dr. Major is going to talk about this, but I actually do see a lot of Medicare patients, and a lot of Medicare Advantage programs will actually cover us. So I'm not sure how much people are aware of that. If they have a Medicare Advantage program, that might be helpful. I know that Medicare, traditional Medicare and supplements are not. And that's something I know Dr. Major's going to talk about. We've been trying forever to get that done in the Chinese medicine world. But there are alternatives. People can go to the Chinese medicine schools. People can go to clinics. I send people to community acupuncture clinics, oftentimes for supportive treatment. And I may do the herbal treatment and the dietary treatment and have them go to community acupuncture for their ongoing therapies and be able to have a lower cost acupuncture treatment on an ongoing level.
Thank you so much. And it's true, there's many different ways to do this. So many different ways. So Dr. Wen, what is your certain strategies or approaches that you take when a long COVID or ME/CFS comes, or related illnesses comes into your clinic? Is there a commonality?
There are, most of them are very similar, have similar patterns. Personally, I prefer the combo of herbal treatment plus acupuncture. For example, like when it comes to POTS, and also a lot of patients with long COVID, they have what we call the vagus nerve, the number 10 cranial nerve, vagus nerve irritation. All the symptoms, it's very, very common. So with that, acupuncture is definitely one of the best ways to address that. But with other conditions like brain fog, like, we're talking about the heart and the other issues. And so herbal medicine can be more precise, more effective if you use it right. And a lot of patients are kind of, because they're not familiar with the Chinese herbs, because every time I always talk about, every time you hear about herbs, it's always bad. There's like, oh, the Afra, always a bad news. That's not all Chinese herbs. If you use the right, what I'm always tell the patients, like, okay, what do you want? You want do you want the 1800 years old ambient, herbal ambient? I have it, 酸枣仁汤. Do you want the 1800 years old Zoloft? I have it. It's 柴胡加龙骨牡蛎汤. Anything you can think of, we have that pretty much in 伤寒论, 1800 years old. It's like, okay, how much more like experiments you need to take? It's like how many people, before us already tried this stuff. Excuse me. And also this time around, when it comes to COVID treatment, for my limited experience, with all the patients, we pretty much all the same, through the whole time. It doesn't matter is Omicron, B4, B5, it doesn't matter it's a Delta, because it's a virus, if as long as it's the same virus, it doesn't matter how you change it, the same virus, we treat it the same way. So that's my experience. And also the other question, most times from patients, like, okay, I've been taking a lot of supplements already. I don't really want to add one more. So my question is always like, okay, you've been taking a lot, does that help you or not? If it's not helping you, you probably give herbs a chance just to try. It shouldn't take long, just give it a couple of weeks, and when you see some good results, you can take more. So there's I agree with the Dr. Cohen about the food. The congee is definitely very important. A therapeutic diet. In Chinese medicine, you can add astragalus, right? Huangqi, make it with the congee. You can use the dangui with the congee. There's a lot of things. Goji berry, you can use that. So the so-called they're eating healthy, eating well. I agree with Dr. Cohen. A lot of times, actually, no, that's not even right. So we have eating any very cold, raw, right? So-called fresh, but it's too cold, and we in Chinese medicine we say it's not good for the spleen. But what that really means is that actually anything too cold, too raw, that lower the temperature, in the GI tract. So your digestive enzyme, because all the digestive enzymes are protein, so the protein cannot function. Protein actually is sometimes very tricky, right? So require certain temperature. If it's too cold, too hot, like you boil your egg, changed. Too cold, it won't function. So that is what that means. So like, okay, you need eat something when you're sick, something easy to digest, easy to absorb, and so kind of like less pressure for the GI tract. So especially when it comes to COVID, the GI impact, that's the dysbiosis, that the gut bacteria is being pretty much like depleted. You have a lot of like yeast, you have a different type of bacteria infection involved, fungus involved. So that's what I always tell the patient. We need a comprehensive approach. Yeah, and herbal medicine, acupuncture, and food are all part of it.
Thank
Christi,
you. So
can I add one quick thing?
sure.
So one thing I teach my patients is if your body were an ATM, thank you, Dr. Wen and Dr. Cohen. If your body were an ATM, when you have something cold, it's an automatic withdrawal from your energy bank. If you have something room temperature, it's a wash. But when you have something warm, it gives your body the energy and the heat to digest the food that's coming. And then I ask them what they're served in a Chinese restaurant. And they always come up with, oh, tea, then soup. And then, oh, if it's salad, the salad is marinated. Yes, because that's cooking. Because we cannot underestimate the power of warming foods on our bodies. My children know, they grew up in Massachusetts. If there's snow on the ground, we don't have ice cream because it's too cold.
Absolutely. And, these are all of the different things. So personally, diet is foundational. You are what you eat. And even times, you don't want to overload the GI system by eating a big meal and then no meal, so you want to pace your energy even in the amount of food you're eating. One thing that I do utilize a lot is I utilize Qigong and self-healing practices, which is huge for those with fatigue, POTS, dysautonomia, to regulate the nervous system, to calm the mind. I mean, that is a really big focus in my treatment strategy as well, and utilizing moxa and herbs and proper nutrition. And also, what are your relationships like? Are you happy? What's your living condition? All of these things affect health. And when you're dealing with chronic illness, you have to look at every single aspect that is going to create and flourish your health, not just one thing. And then, on the functional medicine side, with those with ME/CFS who've been for a long period of time living with chronic illness, it does start to create it impacts the gut. So I do run food allergy tests to look at low level inflammation, that things you might be eating that you've eaten a lot, your body will say, oh, I know that, and it will create more inflammation. So I also do testing and get the diet shimmied down based on what can the person absorb the best. And that changes. That's a moving target, but it is a good place to start when someone has a lot of inflammation and GI issues with these illnesses.